Across South Africa, timely access to specialist care remains one of our greatest health system challenges. The Vula app is helping to bridge that gap. Vula is a simple, secure digital referral platform that connects frontline healthcare workers with specialists in real time. From clinics to district hospitals, nurses, doctors and clinical associates use Vula to get rapid guidance, streamline referrals and improve patient care.
The Vula app is a mobile app that was developed by Dr. William Maypham years ago, where he was working in the rural clinics, and it solves the problem of discussing patients and referring patients between different facilities by creating a platform that's secure and a safe place where doctors can communicate with each other to get advice from specialists or to communicate referrals of patients.
So the best thing for me has been able to oversee what my team is being able to respond, having oversight from that aspect, as well as the referring doctor and both parties being accountable because it's been put on the app, it's logged. I can see where the fault lies if there is a problem and can intervene. So that accountability has made we can manage patients far better. And when there's been situations where there's been issues, you can go back, you can see where the fault was, and you can actually intervene at that level.
So it's been a big help for us. We're private GPs. We see a lot of patients that kind of go to private and public, and it helps us also just make the process easier for anybody that needs to go between the two. It also helps us keep track of how many patients we've seen and how the complex referrals get handled. It gets feedback from the specialist for us. It helps us keep track and keep our notes up to date as well. Very useful.
Instead of long phone calls, missing documents or delayed decisions, Vula provides a structured referral process, clear clinical information, and instant communication. This reduces waiting times, prevents unnecessary patient travel, and strengthens continuity of care. For specialists, Vula helps prioritize cases, manage workloads, and ensure that the right patients arrive with the right information, helping them deliver better quality care.
Especially with patients like pediatric dermatology patients, it's so helpful being able to reach out for help from specialists and getting to slow down that wait time. Sometimes the patient doesn't even need to come in terms of going to the hospital, then step 1 to 3 of their management plan can already be done at your GP, and then you've failed multiple different correct management styles before needing to go in all the way to the hospital and having to wait at a clinic.
So there's been no system that has been as effective as Vula has been in being able to determine which patients need to come acutely to our institution, which patients need to go to outpatients, and which can sort of receive an elective date. And also then filtering out which patients don't even necessarily need to come to our department. And that obviously has saved massive resources in terms of hospital transport costs, and being able to get the right patient timelessly to the department. No phone call has actually been able to do that.
Vula is more than a technology solution. It is a partnership between levels of care, improving teamwork between public and private providers. Through improved communication, quicker decision-making, and stronger linkages between primary care and specialist services, Vula is contributing to a more responsive and equitable health system.
Yeah, so the features that help us when we're doing our referrals are the ability to live chat with specialists. It's very useful to be able to get feedback and advice, even if we're not referring the patient. But other things are the ability to send images and test results and reports from scans and investigations we do, and also get feedback on those. Even just discussing referrals and getting specialist dates and clinic dates less directly than through a real-time phone call, it also makes the process a lot easier for us.
So I've been using Vula for 7 years, almost to the month now. It's been a game changer. it has changed our lives in terms of being able to effectively refer patients, receive referrals and manage those patients. So the value of Vula, I don't think I can actually even describe in words.
I think the reason Vula is so successful is because it really does what it's supposed to do very well. When I was working in hospitals and clinics, we used Vula every day. In fact, Vula has become synonymous with the word referral. We used to say, did you send a Vula for this patient? It became synonymous, and I mean, very few companies can say that they have become, a verb.